get the right tools, you get the most efficacious interventions. At the end of it, you need two things. You need one, a system that can get those tools to the last mile. Now, a system is first of all the logistic of just transporting that. And you know the reality of those deprived communities that there is no infrastructure, there's no road, there's nothing. I think that's one first challenge, is that how do you get your product there? The second thing is you need the people that can deliver, then administer. You know, there are countries where you have 40% of the population resides beyond 5 kilometers of a health facility. That's why it is striking. That's why you've heard now this push that we are pushing toward the 2 million community health workers. And one thing that's also unique and very important for the discussion we are having is that 75% of those community health workers in Africa now are women, and young women. And the push now is that if we can get really young women between 20 and 35 years, we're empowering them, not only that we have an economic return to them, but it's also the skills that transform this new cadre of young mothers that can be themselves the educators of other mothers in the community. Now, that's why we are pushing that if we do that, then we have in places where there's no health facility at all, at least there's a young woman that can deliver these interventions. But then one thing that we are also doing is that sometimes we use a medical kind of approach to the delivery of these interventions, forgetting that we also need to understand the social, anthropological context of administering these interventions. I think that's what we are also bringing into our program to make sure that there's nothing that we can achieve that last mile for the community without the community themselves also contributing to the best way that we can deliver them services.